Today we're going to talk about, we're going to do some overview of our annual enrollment process. And, at annual enrollment, we renew our health, dental, and vision insurance, as well as that's typically the time of year then we also kind of lay out our focus and our plans for the full year and or make any other changes to benefits that we might have on the horizon. We try and kind of coordinate it all around the same time. And so we'll talk about a number of things, and we'll really give you a high-level overview of the benefits. There's not significant changes to plans, so I'm not going to go over the detail of the health plan, for example. But of course, at any time, if you have questions about that, you can feel free to let us know. And now is definitely the time to ask your questions and make sure that they are answered. So one thing this year that we're going to be focusing on, I'm going to show you, I've got a short video that I'd like to share to kind of set up our conversation, and it's called...
Hi, I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23.5 hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a social network, and I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category, but I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked up this intervention and because of its breadth. It worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes, and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 50%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I described in the previous slides. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the aerobic longitudinal study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So, for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that was that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. Most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension. Blair's work is interesting. He also did another trial looking at obesity. What he found was, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss, but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses' Health Study, women who went from 0 activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to exercise. We broke it into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve 150 minutes a week dog walking. And finally, of course, your commute, getting up, stopping early, taking the stairs, and so on and so forth. So thinking about that, I'm just going to walk you through some quick slices of the literature. And the first one comes from Japan. In the 90s, Japan required all employers to conduct annual health screens for their employees. And so a large gas company in Japan called Osaka used this to answer a great question. So if people's walk to work was longer, did that reduce their chance of serious health problems? So in this example, high blood pressure. And what they found is under 10-minute walk, no difference. 11 to 20-minute walk, 12% reduction in rates of high blood pressure or hypertension. And over 21-minute walk, a 29% decrease in rates of high blood pressure. So the authors calculate that for every increase of 10 minutes in your walk to work, there is a 12% reduction in the likelihood of getting high blood pressure. The second exhibit is looking at stents. So this is something we commonly do in medicine. So you can see on the left here, the artery is blocked. On the right, a vascular surgeon has gone in and put in a balloon, opening up and let the stents, which makes great sense. So a German researcher named Rainer Hambrecht looked at this with about 100 cardiac patients. Exercise, and by that I mean 20 minutes a day on an exercise bicycle, and then once weekly in a work class. And the other half got the high-tech stent and just their sort of normal activity. For humanity. Of the exercises were event-free compared to 70% of the people that got a stent. So both worked, but I find it, sort of incredible that made a bigger difference. And you have to remember that the stent just fixes one part of it. The next way to think about it is to refer to what I call sitting disease. We know that being sedentary is bad for your health, but researcher named Leonard Bierman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, spend a lifetime average of 6 hours a day, about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something bad. Clearly, it's powerful with many other risk factors for chronic disease. So I'm just going to leave you with, I guess, 2 quotes. So one is Jerry Garcia, the singer who is the lead singer for the Grateful Dead. And he said, somebody has to do something. It's just incredibly pathetic that it has to be us. And I think that's true, that in some ways it has to be us. Hippocrates said, walking in men's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23.5 hours a day? So something to think about. Thank you very much.
Okay, so I am back, and I was going to flip to this PowerPoint presentation and kind of move on with our main topic. So from that, if you're like me, I took if I take that advice and say I need to exercise or move more, I have been using, personally, I was introduced to these personal fitness devices a couple of years ago, and have really found the impact of just the accountability to this little device that's either on your wrist or on your waistband. Psychologically incredible, I think. If you, if some of you may have them, and if you've ever worn one or used one, I've told a couple of people this story about the time I was using a Fitbit and I was participating in a challenge. You can do online challenges on the Fitbit website or with friends or through an employer site, which we're going to have a tool to do that and have more challenges. And so we've decided to subsidize a Fitbit for all employees. And I can remember a specific time when I had just started wearing my Fitbit, and I was in a challenge online with it, and I was just doing weekend errands, and I was in a strip mall, and I went to Target, and I specifically looked down. I needed to go to Ulta, which was in the same shopping center, but down quite a ways. And I was like, oh, I should walk, get my steps in. I looked down. I didn't have my Fitbit on that morning. I forgot to put my Fitbit on. And so I got in my car and drove. And now, looking back on it, now I think of what a conscious choice that was. At the time, I didn't think anything of it. I wasn't going to get credit for it on steps on my Fitbit, so I decided to drive. And I think of, obviously, from what we've heard just now, what a self-defeating thought process that was, and that I should just be accountable for it. But if you're like me, I need somebody else. I'm not as self-regulating as I should be. So it's really helped me and others I've talked to, and things like this that show us that this activity can help us all. So we're really doing a lot this year, and hopefully we'll maintain some focus on activity and being fit throughout the year. So the company, Fred and Eric and Beth O'Brien from CAF, have committed to subsidizing a Fitbit for all employees. Now, it's a one-time deal. We're not going to do it over and over if you lose it or misplace it, and it's not going to go on forever because it is a very coordinated activity to be able to do this. And so Melissa and Rachel have graciously volunteered, and they're even offering colors. So there's 3 Fitbit styles: the Zip, the Flex, and the Charge HR. On the flyer that they sent out, you'll see that they each do something a little bit differently. The Fitbit Zip will only cost you $10. Its retail value is $60. So we're going to pay about $50 for each employee to be able to get one of these personal fitness devices, so that you can, number one, hopefully monitor and track your fitness activity to meet your own personal goals and to affect your wellness, and then also to be able to do some fun fitness challenges online. So we'll talk more about the wellness program through United Healthcare, but this is a quick order. We want to try and order by the end of the week, so that we can get all the orders in by the end of the week, so that we can order next week and hopefully have the Fitbits in hand in the first week in August, which is when we'll kick off our wellness program, and it will be available to you through the United Healthcare site, or Rally. It's called Rally, and we'll talk more about that later. But if you haven't gotten your Fitbit order in yet, find that email from Melissa Ferris and send that in, so that we can get you a Fitbit. So our benefits packages, we've focused on total well-being, and as an organization, we look at total compensation. Compensation is not just what comes in your paycheck, but the other things that we provide for our employees, and we focus those in all 5 aspects of employee well-being. And as we introduced last year, we look at where things are, what's happening in the market, what's competitive, what do our employees want, and what do our employees value. And so we'll make some changes each year, or as needed, really. And the big thing this year, obviously, that we've done is recently added the company match. I think everybody hopefully is aware of that and heard that we added that in July 1st, and we'll talk a little bit about that today. Also, you'll see we have increased the benefit for our dental insurance and also a little bit on our vision insurance. We've expanded our wellness program. And if you're in California, you may have heard about the legislation that happened in California that regulated paid time off. And while our paid time off policy meets parts of the regulation, there are going to be some things that we have to do differently in California as a result of the regulations. So our paid sick time policy will change for employees in California. And that is included in our total well-being packet that we'll send out later today. Or first thing tomorrow, as soon as our annual enrollment website gets up and running, you'll get more materials on that. But we have not gotten guidance on how to implement it mid-year. So it was a July 1st regulation that they were kind of waiting until last minute because there was more legislation to potentially change it. It didn't go through, so we're going to comply with what's in place for July 1st. But that affects how we accrue and pay sick time to employees in California. So our current policy will need to change for those people in California. And more to come on how that will happen. And then in community, like I mentioned, our group wellness activities will increase, and then many things that we addressed last year and over the last 3 years that we've been putting in place are meeting our needs in the other areas of well-being. So remember, about 45 days ago, I sent out a benefits survey and wanted to make sure that I got your feedback and understood what was valuable to employees, how you rated our carriers, and that this is the time that I should be addressing with them if we have issues that we weren't aware of or that we hadn't heard about. And so through that plan, I'll give you a few highlights. One thing you've seen probably in the last 6 months or so is, we really value what employers are saying. We can ask around, we can get an idea, but it really helps us when we want to know, to be able to go out to the employee population and get feedback. And we've been using SurveyMonkey, and it's a great tool for us to get a quick survey out or something out quickly. But it doesn't have great reporting tools. So I can't share with you. I can see some cool graphs and things like that on our end, but it doesn't bode itself well to sharing the results. So we're going to continue to look for a tool that helps us with that, because a lot of the questions that we ask are kind of open-ended, and you get the feel by reading through, several pages of comments, and it's much harder to dissect into these little bits of pieces. So this is the highlights. We'd asked about your priorities and making sure that we were focused on the right priorities. I thought we were, based on, just what I hear, what I know, what we see with other companies, but I wanted to make sure that we were focusing on the things that were important to you. And you said that the top 5 benefit priorities were, as we expected, kind of the big 5: medical, dental, vision, life insurance, and the 401k, and in particular the match, which we've included now in our plan. And then the next 5 were short-term disability, long-term disability, paid time off, employee discounts, and flexible spending. And so discounts is interesting. That's an area that I can certainly increase. We have the working advantage, and we've got some of the perks that come through our vendors, like the Verizon discount for employees, and we'll continue to try to pursue those where we can. And there may be some other opportunities to add those, knowing that that's important to employees. Also, so we really, the core of the survey was around your level of satisfaction on the value of the plan, not just the cost of the plan. Health insurance is expensive. We've unfortunately had to kind of grow to accept that. And but what's important is what you're paying. How does it compare to the coverage that we're providing in the plan, and what's the value of the plan overall? And if we looked at health, dental, and vision, 74%, almost 75% of employees said that they were satisfied or very satisfied with the value of our health plan, which is great. Dental plan was a bit lower at 69%, and the vision plan, while it's also, the cost is relatively low at a couple of dollars a paycheck for employees, so hopefully that's a good value, was 93%. So that's great. And we got lots of great positive feedback about the weight loss challenge, and so that's why we really wanted to make sure that we were adding more wellness activities in addition to what we were doing with the plans and the plan design. So before we get into the health insurance and the insurance, I did want to take a few moments to talk about 401k, since we've been continuing to get a lot of questions since we added the match in for July 1st. We saw almost 50% of our employees increase their match since in the second quarter when we put the match in place. And we also saw in the survey that employees wanted more education on 401k, and I know it can be a topic that has a lot of complexity to it, and some people even don't participate in the 401k because they don't understand it, and that's one of the biggest mistakes that we can make, is to not start saving for retirement, whether it's the 401k or any other vehicle, because we don't understand it. That's valuable time that we're wasting, because if you talk to financial advisors or if you've seen presentations on the value of compounding interest, which happens in the 401k or any long-term savings vehicle, that ability to start saving early. So financial advisors will say that if you start saving, certainly by the time you're age 25, but really at the very beginning of your professional work life for retirement, they had for years had been saying the benchmark was that you should be saving 8 to 10% of your annual income each and every year throughout your working life to be able to properly plan for retirement. In the information, I've been reading a lot of information in the last year as we prepared to pull the 401k into our own account away from Colony Advisors and spin off in our Colony American Homes plan, and as we're taking fiduciary responsibility for the plan. And now financial advisors really everywhere I'm meeting and seeing, they're suggesting or recommending that you save 10 to 15% of your annual income, and that makes sense if you think about it. My other information, 8 to 10%, is quite old. Since I got into HR and had been administering 401k plans, starting when they were really introduced and replaced plan defined plans in the late 80s and early 90s, it would make sense that would change because we're living longer, right? Just as the video that we just saw, we're taking care of ourselves, we're living longer. I'll never forget, my 40th birthday, I was all about the slogan, 30 is the new 40, and I was celebrating my 30th birthday, and as I arrive upon another milestone next year, now I'm hearing 50 is the new 30, so I'm really excited to once again be celebrating my 30th birthday next year. And so I figured shooting for 100, I think I've talked to friends and everybody's kind of saying, oh, I just want to be healthy at 100, so by the time we're 100, I think that's going to be like 30. I don't know. We'll see, but at least 50. If I'm as I am today when I'm 100, I'll be a very happy camper. But that means that we're going to be supporting ourselves more than 30 years into retirement, even if we work till age 70, which some of you probably have parents. My parents are in their 70s and continue to work in full-time careers well into their 70s. So if we want to retire at 70 or 67, which is the normal retirement age, that means we're going to have at least 33 years until we're 100, and then could go. I don't want to just drop dead on day 101 at 101 days. I'm not just going to drop dead. So I'm still planning on going beyond there. So that's a long time to be able to support yourself with retirement money. So you definitely start saving early. Just as soon as you don't see retirement in your picture, all of a sudden it will be there, and before you know it, and you don't want it to be, you don't want to be behind the 8 ball. It will never be too late because the time will still come. So some people say, oh, I don't have anything in there yet. No sense in doing it. Well, that's not true either. So really important to start saving for your 401k early. If you haven't started or not where you need to be just yet, then make a plan and figure out how you're going to get there. So we do automatic enrollment at 3%, and then it increases annually 1% until you reach 6%. With the advent of the company match and the integration of that into our plan, now we match 50% of contributions up to 6% of your salary, and we do that on a biweekly basis. And there's a huge benefit to that in that some plans, employer matches will match once a year, on December 31st, look back and see how much their employees contributed, and then they put in their match. The downside to that is that you, the employee, doesn't have the company match in their investment account all through the year to grow and take advantage of compounding interest. They get it all at once at the end of the year. So we match as it happens on a biweekly basis, but with that, you also, if you don't contribute on a paycheck, you don't get that match, and you can't get that match back. So you need to plan so that essentially you're saving at least 6% of your salary on every single paycheck of the year to get the most out of the company match. If you, sometimes, I've done before where I'll stop my 401k contributions for a period of time. I used to kind of give myself a Christmas bonus every year, and kind of in the fourth quarter I'd go down, and then in the first quarter I'd bump it back up and I'd go a little bit higher, so I'd go like to 12%. So it still evened out that I was saving what I thought I should be saving for the year, but I felt it differently in my paychecks and thought I was giving myself a Christmas bonus when I was really missing out on my company match. Because, well, I wasn't at the time because they matched at the end of the year, but you would on our plan. So you need to be saving in doing that. So if I, for example, I stop, say, for 2 paychecks, I don't contribute at all, and I don't get company match, and then I come back and I say, okay, well, for 2 paychecks, I'm going to contribute 12%. Well, even though you're contributing 12%, each paycheck is standalone, so we match 50% of your contribution up to 6% of that paycheck. So you can, and in many cases should be saving more than 6%, but that doesn't affect the amount of the company match on that paycheck. It still just goes up to 6%. So you want to make sure you're saving 6%. It's a little tricky with our bonuses paying early in the year each year in January. We've written into our plan that we have a separate bonus election, so you can change you'll be able to change your bonus election next year come bonus time if you want to change your 401k election for that bonus. Some people like to do it up, some people like to do it down, but you're going to want to think about the company match and the full term of the company match. If your bonus contribution is going to take you over the $18,000 threshold, for example, within the IRS regulation for 401k contribution, you may want to be careful that your bonus doesn't eat up all of your contribution, because then you're going to miss out on company match in future checks. So ideally you want to be able to get at least 6% out of every paycheck of the year so that you take most advantage of the company match. All right, and then, and like I said, we're going to plan more education on the 401k. There's a lot available on the 401k website. The www.401k.com is the Fidelity website. I think, wow, they must have gotten that request in early to be thinking of that domain back when people were registering for domains. Either they paid a lot of money for it. So use it. There are great resources and calculators, and this how much should I be saving and where should I put my money. That can all be answered on the website, but we also focus on some education sessions that we are planning for the middle of August. And so we will, much more to come on 401k education, but don't miss out in the meantime, and do your best to get yourself to 6% savings so you can take advantage of the company match as soon as possible. All right? So now let's talk about the benefits for this year, for the kind of a highlight of our insurance benefits, and also a summary of our benefit renewal and our annual enrollment. So with me and on camera also, I have Nicole Crutcher, and Nicole is our benefits broker, so she negotiates all of our contracts with our vendors and helps to get all of our plans set up and make sure that we maintain plans that are competitive with our competitors in the marketplace and that are also meeting all of your needs. So I'll introduce Nicole to talk to you for a bit. I think you can see her.
Hello. Good afternoon. So a couple housekeeping things before I review everything. First of all, you will be getting an email within the next, by tomorrow morning at the latest. And it will have detailed summaries of all the plans, all the information that I'm going to review just on a very high level today. So it will be in that email. Also in that email will be instructions on how to go through the renewal process if you need to make any open enrollment changes. So you might remember that last year we did the PlanSource and through the year. So you will log back into PlanSource. There'll be instructions in the email. You'll log back into PlanSource, make any of the changes that you need. And in there also is an info center where you can find a lot of the detailed information. So we've been getting a lot of questions about that, and I just want to make sure you know that all that information will be coming and it is available to you. Just to review the renewal this year. So our renewal for Colony American Homes is August 1st. The plan year runs August 1st through July 31st of next year. And to just summarize the end of this past plan year, the renewal rates that we get from the insurance companies are all based on how Colony American Homes performed. How was the experience loss ratio? How many claims came in? How well was the company? All of those things impact the premium renewal that we get this year. And so I'm very happy to be able to tell you that Colony American Homes did well. The trend right now is about 8% for renewals for companies, and we were able to lock in a 5% with United Healthcare for the medical. So very competitive, very proud of that, and you should pat yourself on the back because this is really directly related to the employees and how well they're doing with their wellness and preventive care and their overall health. Additionally, there will be minimal increases to the employee contributions, and in fact, they've actually decreased the contribution for covering family a little bit. So the overall increase to employees is at 4%. The dental plan renewal was with Lincoln Financial, and the claims unfortunately were pretty high this year, which means that we were all using our dental plan, which is good, that we had a good plan that we could use, but those claims did run high and they did give us a pretty hefty increase. So we were able to leverage what we have with United Healthcare and get some better rates with better plan design by moving the dental coverage over to United Healthcare this year. And I'll go into a little more detail about that in just a minute. And then with the life, STD, and LTD through Lincoln, those premiums are exactly the same. There will be no changes. Okay, so annual open enrollment, what does that mean? It means that this is your one time during the plan year, or one time during the year, for you to make any changes. Switch plans, enroll, disenroll, add or remove dependents. This is your time. Because the plan is pre-tax, so any deductions that come out of your paycheck are on a pre-tax basis, there are rules about when you can come on and off the plan. And so this open enrollment period, starting today and going through Friday, July 24th, is your opportunity to make those changes. After that point, you will not be able to make any changes unless they are considered a qualifying event. And qualifying events would be something along the lines of a birth or a divorce or a marriage, any of those kinds of things. During this open enrollment period, like I mentioned, you'll log into www.plansource.com. You'll have instructions again on that. You actually don't have to log in if you are not making any changes. If you're not gonna, you're gonna keep your plans the same, the medical, dental, vision. Even though we're moving to United Healthcare, we're going to map you over to that same plan with the same election that you're currently enrolled in. So you don't actually have to do anything unless you want to make changes or unless you want to enroll in the FSA. If you were in the FSA last year, it starts all over again on August 1st this year, and so you must re-enroll. That will not just carry over for you. The life insurance does have an opportunity for you to increase your election by 2 increments without medical questions, so you may want to take a look at that if you didn't enroll last year, or if you would like to increase it above maybe the $150,000 of guaranteed issue that you might have enrolled in last year. So again, 2 increments. For an employee, that would be by $20,000, or for a spouse by $10,000 without insurability questions. If you want to go above that, you would have to answer the evidence of insurability questions. Also, short and long-term disability, you can enroll during this time if you'd like to. Remember, everybody is eligible that works 30 hours or more, and if you're new, your eligibility is on the first of the month following 1 month of employment. Okay, so there are 3 plans available for medical, but if you do not live in Arizona, then the HMO is not available to you. So pretty much everybody I think on this call would have the PPO 5000 or the PPO 1000 available. These plans are exactly the same as last year. Just want to highlight that on the PPO 5000, this plan has been built so that the deductible only applies to inpatient hospitalization and outpatient surgery, so that even though the deductible is high, it's a very rich in that you can get a lot of the normal day-to-day benefits without having to meet the deductible. And the plan cost difference between the two is pretty significant. So you could look at it as take the savings, sock it away, and really plan for that situation that might come up where you could have the 5,000 situation come up. But it might not happen this year, so you'd have that money socked away for future years if that was the case. The contributions are changing just slightly, like I mentioned before, 4% on average. In a couple cases, they went down. So take a look at that, but very happy that the differences to your paycheck is very small. So that's really a big success. All right, dental. I mentioned that we are switching over from Lincoln Financial to United Healthcare. And we are making a couple tweaks to the plan, and big improvement actually on the maximum benefit per calendar year. We're improving it to $1,500 per member per calendar year instead of $1,000. And on the basic coverage for the in-network plan, we're adjusting that to 80% because a lot of our very high claims were coming from that category covered at 100%. So it's a little bit of tweak to bring claims into check, but I don't think that should really affect anybody. With that new maximum at $1,500, it should be a big improvement. And then one little note there, if you have already maxed out the 1,000 maximum with Lincoln Financial, this is actually an opportunity for you. You get the full $1,500 for this calendar year, the remainder of the year, and then it will start over again in January. So it is an opportunity for you to really bulk up on the dental if it works out, and that's what you need to do. But the two plans are still the same. We have an in-network plan and an out-of-network plan. Again, as I mentioned before, you will be mapped to the plan that you were previously enrolled in if you were enrolled with the same dependent elections. If you want to make a change, then you definitely need to log in and make that change during the open enrollment period. And also one other note, because it's United Healthcare and we're already with United Healthcare for the medical plan, you will have the same ID number, you will use the same login to myuhc.com. You will get another dental card, but you should be able to see everything online. And hopefully that will make things nice and easy for everyone. A vision plan, really no changes here. It continues with VSP, which is absolutely the best when it comes to vision. So no changes to contributions either. One little improvement, which is nice, on the frames, the allowance has been increased from $130 to $150. So that is something that we have been able to improve the plan while keeping the costs the same. So that's good news. All right, so I mentioned before that the deductions are all taken out on a pre-tax basis, and this slide really just illustrates the power of the pre-tax reducing your taxable income and putting more spendable dollars in your take-home. So it's just a great benefit to be able to pre-tax those deductions. Along that line, we also offer a flexible spending account. And a flexible spending account is a good way for you to be able to take dollars out of your paycheck and put them aside to pay before taxes for eligible expenses, medical or dependent care. And it's a nice way to also increase your spendable income. Flexible spending accounts for medical, this also includes dental and vision, of course. You can set aside up to $2,500 per year. It is deducted on a pre-tax basis every pay period. The plan year runs August 1st, again, through July 31st, so just be aware that the plan year ends on July 31st, so you need to use your money by then. It is a use it or lose it plan, which means if you elect the full $2,500 and you do not use it all up, the plan only has a carryover provision of $500. So $500 of unused money can roll over to the next plan year, but anything else that is unused would be lost. So you definitely want to incur those claims, get everything spent in July if you can. You have a couple weeks left. Highly encourage you to exhaust all options to use up as much as possible. Things that you can use that money for, obvious things, deductibles, co-pays, prescription co-pays, dental expenses, orthodontia isn't covered on our dental plan, so this is a nice way to be able to cover any braces for the kids or even adults. Also, dental expenses, sometimes people just have, implants are really, really expensive, $5,000. Well, if you go above the plan max on your dental expenses, if you go up and over it, you can use pre-tax money through your FSA to cover those things. Vision expenses, exams, glasses, contacts, lenses, even the contacts lens solution. Just make sure you have your receipts for that, and LASIK. So lots of things you can use to spend that money on. We also have a separate flexible spending account for dependent care, and this is up to a $5,000 limit. This is for children under the age of 13. They have to live with you, and you have to be working. So if you're married, then your spouse has to be working also or be a full-time student. How do you get reimbursed? Well, with the medical portion, you'll receive a debit card. The PlanSource, who is the administrator for Colony American Homes, refers to it as a Benny card. You'll receive that in the mail. You can use that debit card to pay for any of your expenses. If they are co-pays or in the medical plan, a standard co-pay for an office visit, they should just go right through. If it's something for an odd amount or a big expense, they're most likely going to flag it and request that you send in a receipt or EOB or something substantiating that it was medically necessary. You can also file a claim, and so for dependent care, you would have to actually submit your claim. And you can submit that. They have lots of ways. You can either fax, mail, submit it online. They even have a mobile app where you can take a picture and submit it in that way. Lots of ways that you can be reimbursed. I will just highlight again, the name of the company that we use for administration is PlanSource, INFINSOURCE, PlanSource.com. And then again, just to reiterate, it is a $2,500 maximum per year for the healthcare portion of the flexible spending account. And then if you decide to do the dependent care, it's $5,000. And then this diagram illustrates, again, just the power of being able to pre-tax those dollars instead of paying with after-tax dollars. It's really a very nice way for you to be able to increase your take-home. All right, moving on, life insurance, AD&D, and disability insurance. As you know, Colony American Homes pays for a basic life insurance policy for you as an employee, all employees. It is 1 times the annual salary up to a maximum of $100,000, and it includes accidental death and dismemberment. The benefit, and you might be wondering, well, what salary are they using? That salary is based on the prior year W-2, and it includes your commissions and bonuses if applicable. We already touched on the fact that voluntary supplemental life insurance is available. It is available up to 5 times your salary amount, not to exceed $500,000. If you're new, you could get $150,000 of guaranteed issue amount. If you've passed that new enrollment, as most of the employees on this call have already enrolled, then at open enrollment, your option is to take up to 2 increments, or $10,000 for an employee, $5,000 for a spouse. So you can get 2 increments at that guaranteed issue during open enrollment. Also, a housekeeping thing here, you should check on PlanSource when you're logging through, just touching through everything. You should make sure that you have beneficiaries on file for the life insurance, and there's actually a separate spot for voluntary life insurance. So please make sure that you have those filled out. And to highlight something that we haven't talked about very much in the past, we have mentioned it, but it's a great free resource for you, is the Employee Connect Employee Assistant Program. This is available to you and your immediate family members. You can get up to 4 in-person sessions per person per issue per year. So that's a lot of counseling or advice or whatever the topic may be. It could be financial, it could be mental health related, it could be stress, whatever. Uh-oh, something's happening. Okay, I think we're back.
Okay, I think we're all good. Where's my... I don't know how to get the... There it is.
There we go.
Oh, good. So you just watched us like we could have played it cool, but we didn't. So let's just go back to the show and pretend that never happened.
Anyway, definitely know about and take advantage of the Employee Assistant Program. And again, the information and the phone number for this is in the info center of PlanSource. So if you do need that phone number, you can just log in there and grab it. It's all confidential. Okay, so the last thing that we really want to talk about and we're very excited about is the wellness program. United Healthcare is implementing a brand new online wellness website called Rally. So as of August 1st, it's not on there today, but as of August 1st, when you log into myuhc.com, there will be a Rally logo on the page, and you click on that, and it will ask you to make your own password for that. That is the wellness website where you can take advantage of all different kinds of things. The Fitbit, the whole point of the Fitbits is to get you engaged and take on some challenges and get some personal missions and goals accomplished to achieve wellness. And so we're super excited about the new Rally site. As I mentioned, it starts on August 1st. The greatest thing about it is that it pays you. So you can earn, if you're insured, up to $200 per plan year, and $200 if your spouse is covered and goes through the same things. And there's a lot of ways you can build up to the $200. There's a very easy health survey that actually, when you log in, it basically makes you do it. And you get $25 just for completing that. If you do the biometric screening, they pay you $75. So these are things that you do anyway. The biometric screening, if you're not in Arizona, you can still take advantage of it. Very easy. There is a form that you can print out, take to your doctor during your physical. He fills it out and submits it to United Healthcare, and they will upload it into Rally for you. Or you can sign up online and go straight to your closest LabCorp lab, and they will do the screening and load it in for you and get you the results. So very easy ways for you and your spouse to take advantage of the health survey and the biometric screening, and that's $100 for each of you. Also, if you belong to a gym, United Healthcare and through Rally, they have partnered with all kinds of gyms, all the biggies, and there's an opportunity, depending on how often you go. I think you have to go 12 times a month once you register with them, and they will help you with your gym cost by $20 a month. You can sign up for missions through the Rally website. You can do, if you're more hands-on, you want to do a telephone-based coaching program, maybe like smoking cessation or something where you want to be able to talk to somebody over the phone. You can set that up. You can get rewarded for completing that. And also, one really easy one for $25, just go on and use the cost estimator and compare the cost of an MRI at location A versus location B. They're really trying to get all of their members to be educated and know that there's a cost difference between different facilities and providers. Again, the maximum is $200 per person. I talked about biometric screening, so you can download the form, take it into your doctor. Again, after August 1st is when we want to really start going with all of this, and you're going to be getting more information from HR for sure, promoting all of this, because we want everybody to do the screenings and the health surveys and get their $100. You can also go to a LabCorp and do it that way. The health survey is very easy. I don't know if it even takes 15 minutes to complete. I guess it's how long do you think about the questions, but you can see there's a little sample question there, and it is just super easy, very, very easy to navigate. And then when you're done, it will give you your Rally age, and it will tell you, maybe I'm 40-year-old, but through all of my answers and my numbers with the biometrics, I come out to be 45. So it gives me submissions. Nicole, you might want to eat better or exercise more or meditate, or I don't know what they all are, but certainly it will give suggestions for missions that tie in to the wellness program, and they will help you develop your own action plans. You can use the coaching. I talked about the fitness reimbursement. I'm going through these pretty quickly. My healthcare cost estimator, and then the ultimate reward. you go in and you can take that money to the bank. Basically, you get a gift card for whatever money you have earned, and they have all these retailers, places that you use every day. So very cool. In addition to the system that we've just shown out, the program, there's also all kinds of community blogs. There's challenges that you can join, very much like what's on the Fitbit app, actually. They have set up challenges where you can go in and winners get entered in sweepstakes and win prizes. The system, for how interactive you are with it, allows you to earn points and coins, and the coins can be used to buy things or enter different raffles and all different things. So they're really building up this website. I encourage you to take a look at it at August 1st when that date rolls around, and be involved, and you'll certainly be hearing a lot more from all of us about doing that.
All right, great. Very good. Thanks. So we found on the last call that with so many people on the phone, it was hard to go into a Q&A, but like I said, this session really is for you and to get your questions answered. So the online chat is open, and I know Robert's been monitoring, and I'll hop on there also and try and make sure your questions get answered through the chat feature. And or if you, so you're welcome to stay and kind of watch that and see what the questions and answers are there, or wait until you get the link for annual enrollment, and you'll get a lot more information through PlanSource, on the PlanSource website. All of our plan documents will be there and everything to answer your questions. Or feel free to give us one of us a call, send an email, or send an email to the general HR at the CAH Human Resources box, and we'll answer it for you there. All right, thanks for joining us this afternoon, and I'll look at the chat and see what questions are there. Otherwise, have a great day.